How's it going, y'all? So today we're going to talk real quick about Medicare. The open enrollment is starting October 15th. It runs through December 7th. So now is a good time to talk a little bit about that. The first thing I want to say is Medicare and Medicaid are not the same thing. In Arizona, it's access. Sometimes I get calls where people confuse Medicare with Medicaid. They're not the same thing. Both are run by the government. However, Medicare is typically for people over 65. If you've been disabled for 2 years or more, then you can qualify for it as well. Whereas Medicaid has to do more with lower income families. Now, you can have both at the same time. If you qualify for Medicare and Medicaid, there's specialized plans specifically for that. Now, the other thing is to clear some things up and to make it real simple. You can think of it like this. Medicare Part A is going to cover your hospitalization things. Medicare Part B is going to cover your doctor's visits. Medicare Part D is for your prescription drugs. And then Medicare Part C or the Medicare Advantage plans are going to take Medicare Part A and Part B, and a lot of times also Part D, and combine them into one plan. Those are run by individual private companies. And then Medicare supplement plans or Medigap plans. Now with those, all they really are plans that are in addition to Medicare. So you'll have Medicare Part A, Medicare Part D, your prescription drug plan, and then what you'll also have is a Medicare supplement plan. And these kind of work like this. If you just want to have a flat payment month after month, year after year, and that's all you're going to pay, and no matter what happens to you, it's going to be covered, but that cost per month is going to be higher, Medicare supplement plans are great. If, on the other hand, you're more worried about the cost on a month to month basis and not so much worried about if you get sick because you're in good health, or you're just completely fine just paying a little bit more the way you normally would with one of your traditional employer type plans, then a Medicare Advantage or a Medicare Part C plan would work well for you. Now, that's just a quick overview. The real reason I wanted to talk about it are the differences in the way prescription drugs are going to be covered from 2024 to 2025, because this is going to be the biggest difference in which plan you're going to choose. If you have a Medicare supplement plan and then you also want to go with a prescription drug plan, or you have a Medicare Advantage plan. The reason for that is a lot of people I've worked with in the past make choices on which plans they go with based solely on their prescriptions. The reason for that was because of the coverage gap, the catastrophic coverage phase, excuse me. All those things played a role in what they chose to go with because those prescription drug costs could be extremely high. Now, one of the biggest differences between 2024 and 2025 is going to be the out-of-pocket spending cap. So what that means is that in 2024, there was no spending cap. You would just continue to keep spending on your prescription drug coverage, even once you got to the catastrophic stage. Now there's a cap on that. So once somebody hits $2,000 in out-of-pocket costs for prescriptions, they don't pay anything else anymore. The catastrophic phase, which I just brought up, was at the tail end of that. So the way it used to work is you had your deductibles, then you had your initial coverage, then you had your coverage gap, and then you had your catastrophic phase. Well, the coverage gap is going to be completely eliminated. So that was when people would normally pay 25% for their prescriptions after they paid a certain amount, or after the insurance companies then paid a certain amount during the initial phase, which is when they have their copays and things like that. They would have to pay 25% during that, and then they would switch to only paying about 5% after that. So now both those are going to be gone. So the coverage gap is going to be completely gone. And then no longer going to be that catastrophic phase either. So basically what's going to happen now is once someone hits $2,000 out of pocket, they don't have to pay anything else. Now, why is that such a big difference? The reason why is because the prescription drug plans all differed in costs based on how they handled the coverage gap, the catastrophic phase, and the deductibles. The main difference is you're able to choose a plan that may be cheaper because at the end of the day, everybody's going to end up paying $2,000 out of pocket maximum each year. So this is a great change for everyone. I'm really excited about it. I remember when I first got into working with Medicare beneficiaries, one of the things I was always concerned about was how much they'd have to pay out of pocket if they had those really expensive drug costs. Not an issue for anyone. So Medicare's gotten even better for those seniors and those that are disabled. Now you can rest knowing that you'll have your out-of-pocket costs for your doctors and things like that. But when it comes to your prescription drugs, once you hit that $2,000 out of pocket, you no longer have to make those payments at all. So If you do have really expensive medications and you're paying, $5,000, $6,000 in your first couple of months, know that after you pay your first 2,000, you don't have to pay anything else. So that's all I really wanted to cover today. Hope everybody has a great rest of their week. I'm looking forward to working with all the Medicare beneficiaries starting October 15th. If you're interested in working with me, you can go to the link benefitsoasis.com. We can talk about it, see if it makes sense for us to work together, and see if we can get you on the right plan. And I'm also open to answer any questions anybody has as well. So definitely drop a comment. If you liked the video, make sure that you like, comment, and subscribe. It does get the information out to more people. I know a lot of people are especially going to be happy about what we have going on now with Medicare and the recent changes in the drug costs. Everybody have a great rest of your day.